your Envision 2020 campaign and challenge match. Why don't you remind us what that is and give us an update on where it stands right now?
I'd be glad to. Well, first of all, the Foundation Fighting Blindness is the leading funder of research around the world to find treatments and cures for retinal degenerative diseases like the one I have, retinitis pigmentosa, age-related macular degeneration, Usher's syndrome, the leading cause of deafness and blindness in this country. And they affect more than 10 million people in the U.S. and many times that number around the world. And when we started, there was almost no research being done when I lost my sight, and very little known about the retina and about these diseases. And so we had to populate the field with people, first of all, very good basic scientists and clinical researchers, and got going very fast with that. Fast forward to now, thankfully, we built up the knowledge base, both of these diseases and of the retina, and we now have 20 clinical trials underway in different fields, in genetics and gene therapy, in stem cell therapy or cell regeneration, in pharmaceutical or biotech therapies, and even something called optogenetics, which is fabulous, and in retinal prosthetics or a bionic eye that we have funded.
Is the idea of going scattershot and trying so many different approaches because you're fighting so many different kinds of blindness, or is that just because you're still not sure what's going to have the best chance of working? The
latter, I think, Becky. Really, what we have, our secret weapon, our greatest asset is our world-class scientific advisory board, and they know very in depth about all of the kinds of disciplines that are needed to focus on this, because you can't be sure that any one of these different research thrusts is going to work for everybody or even for anybody. Fortunately, now it is. They are. Gene therapy is working with children in a disease, severe disease that affects children. They're born blind or they go blind in early childhood. Mm-hmm. And there are now over 100 people who have been treated with a normal replacement gene therapy that has restored sight to almost all of them, and in significant ways. We'll hear more about that later. But because gene therapy can work only if you know the gene mutation, and then you got to be able to deliver the therapy to the place where it's needed. That's one form of treatment. I think stem cell therapy is going to be very important, where you can make take a person's skin cell or blood, a cell from their blood, the DNA, and change it into a pluripotent cell that can then be turned into a cell of the retina, one of the photoreceptors. So there's a way. That's the holy grail, and that's coming fast. And there's a couple of trials going on.
We have someone from.
Well, that's the gene therapy, which will be great. And then there are a lot of novel medical therapies that slow it. So the match. Should I go ahead?
We're gonna come back to that definitely as soon as we take a quick break. Coming up, Kellogg's CEO John Bryant joins us next. Stick around. We'll be right back. Spark Therapeutics is racing to find treatment for debilitating diseases using gene therapy, and they've had some pretty remarkable results so far and have moved into phase 3 clinical trials with one of their treatments for blindness. Right now, you are looking at a video of an 8-year-old patient enrolled in the study. The video on the left shows him navigating through a sight obstacle course before treatment. The video on the right shows him after treatment. Here to tell us more, Dr. Jean Bennett, who is one of the scientists conducting the study. She's also the co-founder of Spark Therapeutics and also the CEO of Spark. Jeffrey Marazzo, also Gordon Gund, our guest host. And we had a discussion earlier this week about companies that have neat symbols to describe what the company does, and Spark has one of those because the symbol is ONCE, once, and that alludes to gene therapy possibly having one treatment enough to actually cure certain diseases. I got that sort of right. It may not always be that way, Jeff, but some of them.
Yeah, that's right. So obviously the promise here is by fixing the underlying blueprint of what a cell needs to function properly, you can actually potentially restore, in the case of this young boy, as you just saw, restore their functional vision and do so potentially in a long-lasting effect. And what we've seen in patients like that subject was that over many, many years, we actually see the ability of that improved restoration of functional vision and as well as retinal sensitivity actually maintaining itself.
I mean, if gene therapy is correcting a defective gene, it would make sense maybe if it was taken up by a cell that was going to continue to live, it would have that new genotype, right? And so it could
Absolutely.
be it is something to shoot for, and it's feasible.
Absolutely. This could, we think that this could lead to a one-time treatment, or at least rescue vision for many, many years, as we've seen in our patients.
Cure blindness.
Exactly. That's our goal.
Sounds like, almost sounds like we're way into the future in science fiction. I wish we had an hour, but for my own knowledge, most blindness does it involve the retina, which is part of the brain? It's the front of the brain, right? Does most blindness from birth, or is it the blindness that comes progressively as a person lives? What is it always the retina? Because some of it is macular.
Yeah, well, the macula is part of the retina.
It is part of the retina.
Yeah,
okay.
Most inherited blindness in the retinal degenerative diseases involves the back of the retina, the cells which begin the whole process of vision.
And there's a defect in one of the genes of those.
Yes.
How many of the RP, and we've heard RP, we've seen the ads, that you don't have to be a scientist to know about retinosa, pigmentosa. How many are candidates for a one gene fix of the...
Well, there are now more than 260 different genes which have been identified which cause this form of the disease. This is work funded by Foundation Fighting Blindness largely. And many of those are now candidates.
You
there are
can
at
do
least
it. I
2
mean,
dozen.
just because there's 260 doesn't mean you couldn't identify it, put it into a viral vector, and what is it called? Transfect, and actually transfect.
It's actually infection, yeah.
Infection, yeah, and then actually have it taken up and work, right?
Each one will be different, though, don't you think, Gene? In other words, they're different size molecules, for example, so the delivery system's going to have to vary.
Viral vectors.
Yeah, I think so. And also, that number of genes that Gene mentioned represents about 60 to 70% of what is believed to be the total number of these diseases that have different genes. So it's not all the way there yet. So, but one of the things about this very exciting treatment is that it represents a real collaboration between not only the Foundation Fighting Blindness and the National Eye Institute, which has funded part of this, and of course the Children's Hospital of Philadelphia and the University of Pennsylvania. So academic, government, not-for-profit, and at last Spark Therapeutics, which is a for-profit company, which is the way these things are going to get to the marketplace in the last analysis. So very exciting way in which this took place. Unfortunately, over many years, as Gene said, it never happens fast enough.
And there was some controversy about that maybe some of the effects weren't permanent or weren't long-lasting, and it wasn't with your, I don't think it was Spark, it was someone else that's doing similar thing.
Yeah.
Would it matter if you had 3 years later, you had to, or 5 years later, if someone had to have a booster shot or something? Doesn't seem like a big deal.
Yeah,
you have to change your stock symbol, but it doesn't, right? It doesn't seem like it.
I think the first key point to that, obviously there was some questions about this over the last couple of weeks, and the key point is, one, it wasn't our trials and it wasn't our product. And I think most importantly, one of the things that we've now been able to educate people about over the last couple of weeks is that there's a lot of small details that really add up to big differences in these products in gene therapy. So things, for example, like the formulation of the way we put our product together. We showed in some preclinical studies you could lose up to 80% of your product on a needle if you didn't actually formulate it in a certain way. And we were doing that, whereas others were not doing that. So those details really matter.
How difficult was it to find all 260? I'm sure they're not all on the same chromosome, even, are they?
Oh, no, they're
all over the place.
All over the place.
It sounds like it sounds very difficult, obviously. But that work's already been done, right? Now the rest is...
Well, the work's been done to identify, as Gordon was just saying, been identified what we think is maybe 60 to 70% of the root causes. What we're doing and what you just saw in that video was actually just one of those genes, right? So our first work is just fixing...
It was specific to that child.
Specific to that child. And I think it emphasizes a couple of things. I mean, certainly for us as a company, it emphasizes the potential of what we could work on beyond that one project. And certainly from the investment community, there's been an excitement about the potential leverage we can take from that one project to the next projects. But I will say as well, this does emphasize the real important paradigm shift, whether you call it precision medicine, whether you call it the importance of genetics, the ability to actually understand, and for patients, and this is something we constantly talk about, to understand their underlying genotype is really important, because at the end of the day, what we're going to be able to do, we think, is to fix that underlying root cause, and knowing your genetics and knowing your genotype is going to be really important in that basis.
How hard is that?
It's actually, I mean, today, over the course of the last 15 years, that cost and time to actually sequence a gene or identify that underlying gene has come back to literally.
Do you need to put, does the gene that's taken up need to be in the same location it was, or can it just go anywhere and just express the protein?
It needs to be in the cell,
That's
which
hard.
manifests
in the
disease.
cell, but
yes.
it doesn't need to be in the exact part of the chromosome.
No. In fact, this does not integrate into the chromosome. That's an advantage.
It doesn't even integrate into the chromosome.
No.
It stays in the viral vector and it's expressed that way?
It stays in the nucleus of the target cell, which you can only do in the retina, because that's one of the few organs, because the cells are not dividing anymore, so it's not diluted out.
See, that's right. I was wondering about that, because somatic tissue, you can't necessarily put a new copy in and have it be expressed in all the...
Exactly.
Right, but for example, we could do this also in something like the central nervous system. We could do it in a place like the liver, where they're permanent. You don't have turnover in those cells, and so we're working on those areas as well.
Great. So unbelievable to see the video and cure blindness. It's great. Thank you. Great.
Thank you.
Thanks for having me.
Thank you.
Appreciate it.
Terrific.
Yep, thanks.
Our guest host all morning has been Gordon Gund, and we very rudely cut you off, I would say, before the 7 o'clock hour ended. We were talking about your foundation, and you were talking about some of the research that's being done.
Well, which is now extremely exciting, and we are delivering on our mission of finding treatments and cures for retinal degenerative diseases. So my wife and I, recognizing this and wanting to jumpstart a campaign, because this treatment trials cost a lot of money, a lot more than laboratory research. So we issued a challenge match for gifts over $25,000, new and incremental, and hopefully much larger than that. So it's uncapped, of a dollar-for-dollar match for people who will do that, and they can pay it out over 5 years, so by 2021. And so far, we started this about a year ago, and our goal was to raise an incremental $50 million, which with our match would equal 100. Well, so far we've raised about 54 altogether, including the match. So we're at 27 million and counting, and lots of asks out. So very exciting. People can learn about it on our website, fightblindness.org. There's a lot more detail about the challenge match and how it works.
Gordon, thank you so much for joining us. It's been a pleasure. That does it for us today. Right now it's time for Squawk on the Street.